CEN Prep free. Question 1. A patient with an open fracture of the tibia is brought to the ED. What is the priority nursing intervention? Option A. Administer 4 antibiotics. Option B. Cover the wound with a sterile dressing. Option C. Check distal pulses and sensation. Option D. Apply a splint. The correct answer is option C. Check distal pulses and sensation. In any fracture, especially open fractures, neurovascular assessment distal to the injury is the priority. Checking pulses and sensation ensures there is no vascular compromise or nerve injury. For antibiotics, A, wound dressing, B, and splinting, D, are important but secondary to neurovascular assessment. Question 2. A patient is diagnosed with a UTI and prescribed nitrofurantoin. What is an important patient education point? Option A. Take the medication with milk. Option B. Complete the entire course of antibiotics. Option C. The medication may turn the urine bright orange. Option D. Avoid foods high in tyramine. The correct answer is option B. Complete the entire course of antibiotics. Completing the entire course of antibiotics is essential to prevent recurrence and antibiotic resistance. Nitrofurantoin should be taken with food, not milk. A. It may cause brown or rust-colored urine, not bright orange. C. Tyramine avoidance, D, is important for MAOI medications. Question 3. Which of the following is a priority intervention for a patient with priapism? Option A. Administer pain medication. Option B. Apply ice to the genital area. Option C. Prepare for surgical intervention. Option D. Administer oxygen. The correct answer is option C. Prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with a swollen, painful ankle following a fall. The nurse notes that the patient is unable to bear weight. Which test should be performed to guide the need for X-raise? Option A. Ottawa ankle rules. Option B. Pivot shift test. Option C. Lockman test. Option D. McMurray's test. The correct answer is option A. Ottawa ankle rules. The Ottawa ankle rules are clinical decision rules to determine whether X-raise are needed for ankle injuries. Inability to bear weight is one criterion that indicates the need for X-raise. Pivot shift, B, and Lockman, C, test the knee for ACL injury. McMurray's test, D, tests for meniscal injury. Question 5. A patient presents with signs of hypothermia. Which core temperature indicates severe hypothermia? Option A. 32 degrees Celsius. Option B. 30 degrees Celsius. Option C. 28 degrees Celsius. Option D. 26 degrees Celsius. The correct answer is option C. 28 degrees Celsius. Severe hypothermia is defined as a core temperature below 28 degrees Celsius (82.4 degrees Fahrenheit). At this temperature, the patient may be unconscious with minimal or absent vital signs. Mild hypothermia, 32–35 degrees Celsius, A, moderate, 28–32 degrees Celsius, B, and severe, 28 degrees Celsius, C. Option D, 26 degrees Celsius, is also severe, but 28 degrees Celsius is the threshold. Question 6. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 324 milliequivalent/L. What is the most likely interpretation? Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. Option D. Respiratory alkalosis. The correct answer is option C. Respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO2. Question 7. Which of the following is a true statement about do not resuscitate, DNR, orders? Option A. A DNR order indicates no further care should be given. Option B. A DNR order is a standing order for all patients. Option C. A DNR order is written by a physician after discussion with the patient or family. Option D. A DNR order can be written only by the patient's family. The correct answer is option C. A DNR order is written by a physician after discussion with the patient or family. DNR orders are written by a physician after discussion with the patient or healthcare proxy. DNR does not mean no care, A. It means no CPR. DNR is not a standing order, B. Family, D. Cannot write the order but can participate in discussion. Question 8. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A. Return to the waiting room in line of sight of the triage nurse. Option B. Resuscitation bay to prepare for intubation. Option C. Isolation room on droplet precautions. Option D. Isolation room on airborne precautions. The correct answer is option D. Isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A. Administer for pain medication. Option B. Obtain a urine sample. Option C. Notify the provider immediately. Option D. Administer antiemetics. The correct answer is option C. Notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 10. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A. BUN/CR ratio 20:1. Option B. BUN/CR ratio 10:1. Option C. Normal BUN/CR ratio. Option D. Elevated CR with normal BUN. The correct answer is option A. BUN/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the BUN/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1, B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Question 11. A patient is brought to the ED after a violent assault. What is the first priority in caring for this patient? Option A. Obtain a forensic evidence collection kit. Option B. Perform a thorough physical exam. Option C. Ensure patient safety and medical stabilization. Option D. Contact law enforcement. The correct answer is option C. Ensure patient safety and medical stabilization. The ABCs in medical stabilization are the priority for any patient, including victims of violence. Forensic evidence collection, A, physical exam, B, and contacting law enforcement, D, are important but secondary to medical stabilization. Question 12. A patient arrives with a chief complaint of the worst headache of my life. Which of the following is the priority nursing action? Option A. Administer pain medication. Option B. Perform a neurological assessment. Option C. Prepare the patient for a CT scan. Option D. Establish for access. The correct answer is option C. Prepare the patient for a CT scan. Worst headache of my life is a classic presentation for subarachnoid hemorrhage. A non-contrast CT scan is the priority diagnostic test. While neuroassessment, B, is important, the CT is diagnostic and should not be delayed. Pain medication, A, and for access, D, are important but secondary to diagnosis. Question 13. A patient presents with acute urinary retention. The nurse anticipates the need for Option A. Foley catheter insertion. Option B. Straight catheterization. Option C. Condom catheter. Option D. Suprapubic catheter insertion. The correct answer is option A. Foley catheter insertion. For acute urinary retention, insertion of a Foley catheter provides continuous drainage and allows monitoring of urine output. Straight catheterization, B, may be used, but Foley is preferred to prevent repeated catheterizations. Condom catheters, C, are for incontinence, not retention. Suprapubic catheter, D, is used when urethral catheterization is not possible. Question 14. A patient is bitten by a venomous snake. What is the priority nursing action? Option A. Apply a tourniquet above the bite. Option B. Immobilize the affected limb. Option C. Administer antivenom immediately. Option D. Incise and suction the wound. The correct answer is option B. Immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Question 15. A patient in her second trimester of pregnancy presents with painless vaginal bleeding. What is the priority assessment? Option A. Fetal heart tones. Option B. Maternal vital signs. Option C. Cervical dilation. Option D. Contraction pattern. The correct answer is option B. Maternal vital signs. Painless vaginal bleeding in the second or third trimester is concerning for placenta previa. Maternal hemodynamic status is the priority. Assessment of fetal heart tones, A, and contraction pattern, D, are important but secondary. Cervical examination, C, is contraindicated until placenta previa is ruled out due to risk of catastrophic hemorrhage. Question 16. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A. Staphylococcus aureus. Option B. Pasteurella multocida. Option C. Streptococcus pyogenes. Option D. Bicnella corrodens. The correct answer is option B. Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24–48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Bicnella corrodens, D, is associated with human bites. Question 17. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A. Carboxyhemoglobin level. Option B. ABG with POW2. Option C. Methemoglobin level. Option D. White blood cell count. The correct answer is option A. Carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG POW2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific. Question 18. Which laboratory finding is most specific for acute myocardial infarction? Option A, elevated creatine kinase -MB, CK -MB. Option B, elevated troponin I. Option C, elevated myoglobin. Option D, elevated C- reactive protein. The correct answer is option B, elevated troponin I. Cardiac troponins, troponin I and T, are the most specific biomarkers for myocardial injury because they are found exclusively in cardiac muscle. Troponin I is not found in skeletal muscle, making it highly specific for myocardial infarction. CK-MB, A, is elevated in cardiac injury but can also be elevated with skeletal muscle damage. Myoglobin, C, is early but nonspecific. CRP, D, is a marker of inflammation and is not specific for me. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with a chief complaint of suicidal ideation. Which of the following questions would be a priority for the nurse to ask? Option A, do you have a plan? Option B, what medications do you take? Option C, do you live alone? Option D, have you attempted suicide before? The correct answer is option A. Do you have a plan? When assessing a patient with suicidal ideation, determining if they have a specific plan, means, and intent is the priority. This directly addresses the patient's immediate risk. Other questions, B, C, D, are relevant for history but do not assess imminent risk as directly. Question 20. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A, inability to abduct the fingers. Option B, inability to oppose the thumb. Option C, inability to adduct the thumb. Option D, decreased sensation in the small finger. The correct answer is option B, inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 21. A patient with a urinary tract infection presents with confusion and fever. What is the most likely diagnosis? Option A, uncomplicated UTI. Option B, pyelonephritis. Option C, urosepsis. Option D, interstitial cystitis. The correct answer is option C, urosepsis. Confusion and fever in a patient with a UTI, especially in an older adult, suggests urosepsis. This is a life-threatening infection requiring immediate intervention. Uncomplicated UTI, A, does not cause confusion. Pyelonephritis, B, causes flank pain, fever, and chills. Interstitial cystitis, D, causes chronic pelvic pain. Question 22. A patient is experiencing a tension pneumothorax following chest trauma. The nurse anticipates which intervention? Option A, needle decompression at the second intercostal space, midclavicular line. Option B, needle decompression at the fifth intercostal space, anterior axillary line. Option C, chest tube insertion at the second intercostal space, midclavicular line. Option D, supplemental oxygen and observation. The correct answer is option A, needle decompression at the second intercostal space, midclavicular line. Tension pneumothorax is a life-threatening condition requiring immediate needle decompression. The needle should be inserted at the second intercostal space in the midclavicular line on the affected side. This releases trapped air and relieves pressure on the heart and great vessels. The fifth intercostal space, B, is for chest tube insertion. Chest tube insertion, C, is the definitive treatment after needle decompression. Question 23. The possibility of an ectopic pregnancy increases when a patient has a history of? Option A, breast cancer. Option B, endometriosis. Option C, teenage pregnancy. Option D, pelvic inflammatory disease. The correct answer is option D, pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors. Question 24. During a disaster drill, which patient should be prioritized for evacuation? Option A, patient with a fractured femur who is stable. Option B, patient on a ventilator. Option C, patient with a minor head laceration. Option D, patient with a sprained ankle. The correct answer is option B, patient on a ventilator. In a disaster evacuation, patients who are ventilator- dependent are the highest priority due to their reliance on life-sustaining equipment and difficulty in moving them. Stable fracture patients, A, and minor injuries, C, D, can wait. Question 25. A patient presents with abdominal pain, vomiting, and a blue-gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue-gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration.